Hello, you're watching News Mongolia and MNB World. I'm your host, Ayundar Wasikho. Our top stories: 1,792 local cases, 26 imported cases and 2 additional deaths reported. It is estimated that 18 to 20,000 daily cases of COVID-19 may occur. It is hard to define the difference between COVID-19 and influenza. For other news, stay tuned. The Ministry of Health reported that 1,818 new COVID-19 cases were confirmed today, 26 out of which are imported cases. Also, 2 fatalities were reported.
The Ministry of Health reported that 1,818 new COVID-19 cases were detected after tests were carried out at PCR laboratories across the country. 2 deaths were recorded in the past 24 hours. All new cases except 26 imported ones were confirmed domestically, out of which 1,227 were confirmed in Ulaanbaatar city and 565 were confirmed in the provinces. 4,781 COVID-19 patients are being treated at hospitals nationwide. Additionally, 14,354 patients are being treated at home. Among the COVID-19 patients being treated at hospitals nationwide, 1,253 are showing mild symptoms of illness and 37 are in critical condition. As of now, around 2.16 million people have had 2 doses of a COVID-19 vaccine and 29.1% of the population has received the booster shot so far. Mongolia has become one of the first Asian countries to administer the 4th dose of it to its citizens on a voluntary basis. Citizens who had been infected with COVID-19 and had the 3rd dose can receive the 4th dose after 21 days after their recovery. The National Emergency Commission stated that the COVID-19 peak is expected to happen from January 20th to February 10th with 18,000 to 20,000 expected daily cases. As the Omicron variant spreads fast, entities are advised to switch to working from home. If the variant is spread among employees of an entity, it is likely to cause a shortage of human resources in no time. The anticipated COVID-19 peak is to be reached around Lunar New Year, hence officials warn the public against the risk of getting exposed to the virus, and it is advising people not to celebrate the holiday wildly.
In recent years, more than 1,000 COVID-19 infections have been reported per day in Mongolia due to the New Year celebrations. On Friday, the first 12 imported cases of the Omicron variant were confirmed. The National Emergency Commission of Mongolia called its meeting on the COVID-19 situation in the country and gave instructions to the relevant officials on improvement of home treatment of COVID-19.
The 4th wave of COVID-19 in Mongolia is expected to peak in late January or early February, according to the Minister of Health in Khbol. The country, with just over 3 million people, has so far registered more than 395,000 COVID-19 cases with 2,000 related deaths. So far, 66.5% of the total population has received 2 COVID-19 vaccine doses, while more than 936,000 people aged over 18 have received a 3rd dose. More than 2,000 Mongolians have taken a 4th dose after the country started offering one from Friday on a voluntary basis. Meanwhile, the National Emergency Commission recommends that vaccinated people and people who are experiencing mild illness be treated at home, as the hospital workload is likely to increase during the peak of the Omicron variant. It already announced that hospitals will pay special attention to the hospitalization of unvaccinated children, the elderly and pregnant women. According to preliminary studies, it is estimated that 18 to 20,000 daily cases may occur during the height of Omicron variant in Mongolia. Moreover, the National Emergency Commission urges elders, pregnant women and those who have not been vaccinated not to participate in public activities during the Omicron wave. Businesses and organizations are also recommended to take organizational measures internally, such as to change to remote work or work in shifts.
In our country, COVID-19's 4th wave has started and daily COVID-19 cases are increasing again. At the same time, the flu season epidemic has started as well, to the point that people cannot tell if they have caught the flu or COVID-19. Health officials advise the public to keep wearing masks and eat nutritious food.
Health workers say that it is difficult to tell the difference between COVID-19 and the seasonal flu, as the symptoms are similar, and in the case of the Omicron variant, patients rarely experience loss of taste and smell. Doctors advise people to observe the people around you and go and see a doctor if symptoms persist.
If at a certain entity, company, or in a family, 90 to 100% of the employees or members are getting infected, then it must be Omicron. If in 20 to 30 square meters, 5 to 6 people work or live together and they all get sick together, it means they are infected with the Omicron variant. Instead, if there is only one person, one child out of the 5 or 6 who is ill with respiratory infection symptoms and the rest of the people are okay, it is no use to suspect that it could be COVID. It most likely isn't. In order to determine the diagnosis for certain, we have to take PCR tests. However, both COVID-19 and influenza can be prevented by using the same precautionary measures, such as washing hands and wearing masks.
Since December, the seasonal flu epidemic has surged. Especially in the evening, parents who brought their children are filling up the hospitals.
My child had a cold for a long period of time. I was giving her medicine, but in the last 10 days, her condition has gotten much worse. She started having a strong, frequent cough with phlegm. That's why we are here, staying at this hospital now.
Per day, around 190 children go to Sungunhagan District Hospital, and 30 children are staying at this hospital. At Bainzurich District Hospital, 150 to 200 children are visiting, and 30 children are staying at the hospital.
I see 40 to 55 children daily. All are aged between 0 to 3 years old, many of them with high temperature, diarrhea, and dehydration.
Many children with laryngitis and inflammation of the voice box are coming to the hospital. Many of them are sick with the flu.
We advise parents to make children go to bed early and do cleaning and improve ventilation frequently at home. Also, don't give cold drinks to your children.
Don't take your children to public places. Wear your face mask and maintain a hygienic environment at home. These measures can prevent you from getting infected.
Now let's check the currency exchange rates provided by Mongol Bank. Thank you for staying with us on News Mongolia. Now let's look at Mongolia's current affairs.
The ambassador of Mongolia to the Kyrgyz Republic, Khan has presented his letter of credence to the president of the Kyrgyz Republic, Sadir Japarov. Following the ceremony, the president of the Kyrgyz Republic received the ambassador and exchanged views on the current state and further potential of bilateral relations and cooperation. Ambassador Khan conveyed the greeting of the President of Mongolia, Khurelsukh, to the President and expressed his commitment to further strengthen traditionally friendly relations and cooperation between the two countries in various fields. Also, the two sides discussed the celebration of the 30th anniversary of the establishment of diplomatic relations between the two countries in 2022, the possibility of cooperation as part of the 1 billion tree initiative of the President of Mongolia, and the export of Mongolian wool and cashmere products to member states of the Euro-Asian Economic Union. President Japarov expressed his support in the implementation of these initiatives and emphasized that the two countries have a great potential to further enhance historically friendly relations and cooperation in the areas of trade, economy, education, culture, science, tourism, and light industry. He also stressed the importance of the implementation of mutual high-level visits on the occasion of the 30th anniversary of the establishment of diplomatic relations between the two countries.
And here's the weather forecast for major cities around the world. Well, that's it for today. Thank you for staying with us on News Mongolia. See you tomorrow with more stories and updates. Have a great evening. Goodbye.